Hi, this is Dr. Tobe Moma, host of Health and Wellness with Dr. Tobe. It's an honor to ask you to watch our show this coming few weeks with Dr. Jennifer Floyd. I'm the president of Faith and Power Ministries, also a family physician at the University of Mississippi Medical Center. It's an honor to host a guest every week on our show. This week we have a special guest. Her name is Jennifer Floyd. She's an optometrist. She's the leader, the founder, and the chief executive of Visual Difference in Ruston, Louisiana. This young lady has started her own outfit almost for the last 13 years, married for 22 years, finished from Louisiana Tech, and she's been a resource for the optometrical society in this part of the country. She's going to be educating you on what it takes to be an optometrist, on why you should see an optometrist, on the benefits of Jesus even in the life of an optometrist. This is Dr. Tobe Moma telling you to watch our show. I approve this message. God bless you. You're welcome to our show, Health and Wellness with Dr. Tobe. This is Dr. Tobe Moma. I'm a family physician out of Jackson, Mississippi, Faith and Power Ministries. We love to welcome you on our show once again on this special edition of Health and Wellness with Dr. Tobe. We have a special guest on our show today. Her name is Jennifer Floyd. She's an optometrist. She's the founder. She's the chief executive of Visual Difference. She's the optometrist in charge. And you cannot but be enthralled when you meet Dr. Jennifer Floyd. She's a believer, she's a Christian, she's a mother, she's a wife, she's an entrepreneur, and she's sharing her heart with us. Married, 22 years, lived in this part of the country, Northeast Louisiana, for upwards of almost 20 years, and schooled in Arcadia, and she's a resource for those of you who want to know everything and anything about optometry. So we started by talking about her background, her pedigree, and about what she's done in business as a woman. Today we want to focus on optometry. And last time she shared with us the difference between optometry, opticians, and ophthalmologists. And she's going to elaborate further on that today. So Dr. Floyd, give us an idea. When a patient comes to your office, what should they expect?
They're going to come in and have a complete case history done. We're going to ask them everything about their health history. We're going to completely do a review of systems. We're going to do some preliminary testing, check their visual acuity far away, up close. We check depth perception, color vision, tracking their peripheral vision. We're going to check their pressure, their intraocular pressure, check them for glaucoma. There will be put in my chair. I'll go over everything with them, discuss any concerns that they have, especially if they're diabetic or at risk for glaucoma or at risk for macular degeneration. There's definitely going to be more thorough tests that we will go into. Dilation plays a part, as well as checking the internal health of the eye, making sure that it's healthy. Evaluate them for glasses and contact lenses. There's many things that we do as an optometrist.
What's the age range? I see you have pictures of kids here. Do you see kids too?
Yes.
Okay. What's your age range, from cradle to the grave? Or?
Absolutely.
Okay.
That's absolutely correct, Dr. Tobe. I was trained. I actually spent a little extra time in training in children and pediatrics, and so we were trained to see a baby after it's born.
Okay.
Like we could see it one day in the hospital, okay, into death. People in hospital beds, people in nursing homes. So there's really no age limit. In fact, the American Optometric Association recommends that a child have their first eye exam at 6 months, at 3 years, and then every year after that. So I encourage patients definitely to have their children's eyes evaluated every year. So just because they don't have glasses or don't need glasses at that time, it can change. And that is something that people they don't realize. They'll say, well, my eyes are good. How do you know that? 1 in 4 children have lazy eye.
Wow.
And they don't know that. Those are things that are missed in school screenings, because if you with both eyes open, it's hard to tell. And children are very smart. They can memorize things and do really, really well. So, yes, have them evaluated very early,
Wow.
6 months. And in my office, I am an infancy provider.
Wow.
And what that means is that I will do a free eye assessment on children, infants, 12 months of age and younger, free
Wow.
of charge.
Oh my
And
goodness.
no insurance, anything. If
So they don't
have,
need to go to Shreveport or Jackson or Memphis. They can come straight to Visual Difference right there in Ruston if their children need a visual exam.
Yes, and the program under infancy, you can look that up. There's actually, it tells you all the things, and that evaluation is very, very important because parents, they all know that there are certain developmental stages, developmental milestones, like, rolling over, sitting up, crawling, and walking. Well, there's developmental milestones in the visual system as well, and if those visual milestones are not met, it could actually cause the child to have problems when they learn in school, like with their reading. And there are things that I can show them and teach them of what to do at very early on to ensure that their baby's eyes stay healthy and that they are properly functioning. And it's not to give them glasses. That's what people say, well, my baby doesn't need an eye exam. They don't need glasses. Well, there's way more to it than that. Yes, it's not about that. Just for instance, how many times do you take your infant to see the medical doctor, the pediatrician, just for well baby checkups?
Once a year.
I want to encourage parents, young mothers, especially anybody, to bring their babies in because this is so very valuable.
And it's called Infant
C.
C. It's an amazing program. Every child under 12 months, you're listening to the sound of my voice. You don't have an eye exam, we recommend you get one by 6 months. Because if you catch it on time, there's a better chance you can remedy the problem, especially with lazy eye. You have here amblyopia, there's strabismus, there's a couple of other things that, So what do you do with things like dry eyes? You have that option also in your office?
Yes, and I never like to use the word hate, but I strongly dislike dry eye.
Oh, really?
And because today it is really becoming chronic. It's a chronic problem, dry eye disease. In fact, many patients come in and they don't even know that they have dry eye.
Wow.
And we do a tear film assessment. I can put some drops in and evaluate their tear film. And with today's use of computers and cell phones, dry eye has really, really increased, even in our children. And so what's happening is the research has been done, and it says that, when you and I are just talking, or if we were having lunch and hanging out, we blink about 30 times a minute. But when you're on screens, or even if you're watching television or doing anything, sewing, or doing anything intently for a period of time, that blink rate decreases down to 5 times per minute. So what happens is the ocular surface will become dry. And then it's a problem. It's kind of like mouth breathing.
Right.
And so by the time you realize that your mouth is dry, what do they say? You're already dehydrated. Well, your eyes are mucous membranes, and we have to treat that. We have to talk about prevention, especially on the screens and stuff with our children now. They need to protect their eyes. They need to moisturize. So, yes, there's many things that we do with dry eye. I recommend that fish oil, take tuna oil, and not all fish oil is the same. I actually have some certification in nutritional counseling.
Wow. Amazing.
So I don't recommend just anything over the counter. Most of the time people don't know what supplements to recommend or to buy. And this product is like the purest wild caught fish that you can get. You won't burp or belch it up. It's not it's not gross. It actually is very moisturizing. It's actually good for memory. It's good for your eyes. It's good for joints, bones, things like that. So the fish oil that I recommend is very, very good, high quality. But for dry eye, it is a problem. I try to tell them increase their water intake. Dry eye is a systemic problem. It's not necessarily an eye problem at all. And so like if you're having dry eye, it's something with the mucous membranes. And so drinking more water, at least half your body weight in ounces of water a day, using the right artificial tears. Not all artificial tears are the same. So I recommend Oasis tears because it is preservative free. It is perfectly pH balanced. I mean, there's so much information out there I could tell you about even dry eye.
You still see glaucoma patients.
Yes.
And then, of course, you see those with visual defects, astigmatism, myopia, presbyopia,
Yes,
and
pink eye.
pink.
Pink eye. If people have pink eye, we are licensed to prescribe all medications, antibiotics, antivirals,
Awesome.
anti-inflammatory
Oh
medications,
wow.
and pain relievers. So there's many times, especially in this area, men, workers will come in and they will have gotten metal in their eye or a foreign
Right.
object, and we're able
You're
to
able
get
to
that out and
get
take care
out.
of them
Oh
very
wow.
quickly.
Wow,
Get them
that's
out of pain.
amazing. And then obviously you have the sty, the Calasian.
Yes,
Okay.
yes.
Well, I'm trying to tell the audience that Miss Dr. Floyd is a full spectrum optometrist. I mean, she can take care of your eye from the cradle to the grave. Diabetics, hypertensives, infection, conjunctivitis, allergies. She
Yes.
can prescribe medicines as appropriate for the eye condition that you have. And we need to take advantage of resources like Dr. Jennifer Floyd. We're going to put her address on the screen so that you can look her up, you can call her, you can make yourself check her out. But this is for the people watching. Many of them are now interested in becoming optometrists. So tell that young boy who's getting out of high school, what courses does he need to take? What excellent grades does he need to step into, and how does he find a place in this niche called optometry?
Basically, high school, high school degree, you have to have high grades. Of course, a high GPA would be great. When you enter into, you need a bachelor's degree, primarily in science, pre-med, physiology, even chemistry, those things. But they're going to be looking at at a high GPA. You'll have to take the optometry admissions test, the OAT. The scores on that range from 2 to 400. 320 is a good score. It's solid.
Okay.
However, 350 would be considered excellent. You need that, and then you'll have to apply. But they want people in optometry that are well-rounded, that are able to communicate and relate to people. It is much more than just prescribing glasses and contact lenses. We truly are primary eye care professionals, and
Right.
you form a relationship with these people,
To the
trying
patient.
to protect their most precious gift, the gift of sight.
Gifts of sight.
And truly, your eyes are windows to your soul, and that's the way I look at it with every patient. Every patient's eyes are different. Every patient's circumstances are different, how their environment, how they use their eyes. So someone who is wanting to go into this profession, if they feel that it's just something that they want to do to make money, and to do that, I discourage that.
Right.
I mean, optometrists really can do so much more and provide something that is so precious, and help in so many different
I mean, they
ways.
make a good amount of
Oh,
money.
yes.
They do well. Dr. Floyd is not looking for money anywhere. So financially, it's a lucrative profession. But like everything else, even the Bible says, "He that showeth mercy, let him do it cheerfully."
Yes.
So you cannot be in a mercy profession like optometry or medicine and be a grumpy, grouchy, irritable and just unhappy person. You're not
Yeah.
going to make a good impression on your patients. So people should expect 4 years of after their
Undergraduate.
undergrad program.
That's right. 4 years of then professional school, and you can apply. There are when I graduated, there was only 17 schools of optometry, including Canada and Puerto Rico. Today, if I'm not mistaken, there's 23.
Okay.
And people go, wow, there's more schools now, so it must be easier to get into optometry school. However, I want you to think about the fact that there's at least one medical school in almost every state, if not
Definitely.
2 medical schools. So it is
Louisiana has
still.
2, I think. So Louisiana actually has 3: Tulane, New Orleans, and Shreveport. So
That's right. So and then as being a Louisiana resident, you're limited because it's divided up into regions. So like I said, Memphis is one, Houston is one, Missouri and Alabama.
wow.
Those are all the schools. But it's hard to get into. But they're looking for people who are well-rounded, truly want to give back to the community, and because
And it's not a you don't just become an optometrist and that's it. You still have to get CME. You still have to
Yes.
maintain a license. You still have to make sure you're doing appropriate for the board to keep your license going. Am I correct?
Absolutely. Every year you have to have so many hours of continuing education. Many of us get more than enough because the classes are very interesting. You have to keep abreast of all the new medicines, the new changes in pharmaceuticals. I mean, things like that are happening constantly, along with all the new technology today.
Right.
You know, the blue tech lenses. I mean, when I was getting out, progressive lenses and certain coatings were not such of a great thing, but now things are just enhanced so much. The technology today is just phenomenal, and so you have to keep abreast of all of those things and those changes.
What should they expect in terms of student loans? I mean, people are just curious. They're listening. They're like, Dr. Tobe, I like to be an optometrist, but I don't want to owe $500,000 by the time I'm done.
Okay, so they do allow regional spots, and so like it would be like an in-state tuition for certain schools if you get one of those regional spots, but those spots are limited, and so then you of course there's student loans, but they do know that once you get out of school, you will be able to repay your debt because I don't know of any that walk across that stage and don't have a job.
Oh,
You know, and
really?
don't have an opportunity.
A job offer is already
That's right.
available.
But you need to network and know the right people, of course, to kind of ensure that. But most everyone, I mean, I don't know of anyone not having a job after you complete your degree. Now, there are national boards that you have to take as well. You take state boards and then you take national boards. And if you don't pass your national boards, you won't get your license. So there are definitely things, just because you go to school, that doesn't mean you will. But I would say, I mean, the debt, I was reading some articles. I mean, it could be $100,000 in debt. I mean, it could.
It's worth it.
It could
because
totally be $100,000.
You could easily make that profit in a year if you open your own business. So I think it's worth it. A doctor comes out with at least $200,000. So
yes, I mean, I was trying to be. I was like, well, not discouraging, but
so,
it truly is expensive.
You know, like they say, you know, uneasy wears the head, wears the crown. I mean, you're gonna pay a price for what you want. Okay, no, nothing is a free lunch.
That's right.
I mean, everybody should know that. So give us an idea. In your office, do you construct this lens? Like I'm wearing I think this is a rimless frame.
Yes, that's
so
very nice.
Do you construct this in the office or do you send it out? And also the question is because I'm trying to, you know, get some information from my patients. And also for the lens, for the contact lenses, do you get them, because people tell me, oh, my contact lens came from China and all that. How does the system work? Because some people do it in their offices, some people it comes from outside the office.
That's right. In my office, I like to have control over that because I have worked in other areas of where I'm doing the prescription, and then if they take their prescription elsewhere, like right now we're faced with people buying glasses online for very inexpensive. Now that doesn't, I mean, I don't like that. I do kind of discourage that, not because I want to keep the money. I want to ensure that what the patient is wearing is what I prescribed. And in a lot of those cases, many times if people order from elsewhere or bring them back and we verify the prescription, it's really been about 47% inaccuracy.
Really?
That's what we have come up, and that's actually been some research done on that. So I try to tell parents, everybody that I see, if your child is not wanting to wear their glasses or if somebody's having problems with the glasses, please bring them back into my office. Let me verify that the prescription was made correctly, because your eyes are like windows and they will adapt to whatever you put in front of your face. And so like that could actually cause a lot of problems. So in my practice, I want an ABO certified optician. We will order the lenses, and I have a lot of stock lenses, and we have an edger, and they will cut and make the prescription in my office. And yes, we can do rimless, and that's not, I haven't always been able to do that, but I just bought a new piece of equipment that would allow us to construct your frame, or your lens in the office. And so as little as 10 minutes, if we have the lenses, then we could cut them and while you wait. But of course, this is getting into our busiest time of year, so please, don't think that it'll be 10 minutes. An appointment would be nice, you know, if we had to make the glasses.
So for those who don't understand the language of optometrists, so these are the lenses.
Yes.
And this
Yes.
is the frame.
This is the frame,
Okay.
and you have a rimless frame. So,
Right.
like when you have a frame that goes all the way around, those, of course, they can be metal or they can be plastic. But now they're getting into a lot of going green.
Oh,
And
really?
you mentioned like China, getting contact lenses from China. That is happening, but those things are not regulated the same as in the
Because they're
United
cheaper,
States.
people are ordering them online.
That doesn't mean that that's the best product for their
Right.
eyes. And I actually had a patient, less than a month ago, that came in, and she had been ordering her lenses from overseas,
Overseas, right.
and no regulation, no nothing. Her front surface of her eyes, her corneas, were in such bad health, and this is a young woman, and she's like, but I can get them so cheap. And I said, but you cannot put a price on your eyes. We are still working on trying to get her corneas back to the health that they need to be. It's been a month. She's very young. This should never happen. The cornea is one of the fastest tissues to heal, and it is because of this kind of thing that people are trying to go cheap. And try to save money. I understand that. I'm a mother of 3. I want the best value as well. Right, but eyesight is precious. Prescriptions have to be verified and things like that. And in my office, we try to ensure that you're going to have that and that you have a full warranty. So like when we make the glasses, if you have any trouble, especially with people who are diabetic, they can have lots of prescription changes. And depending on their A1C, that can definitely cause a lot of prescription change. And we're going to warranty that. We're going to work with you. Contact lenses as well. When parents buy, they don't want to necessarily buy your supply of contacts. And I'm like, buy your supply of contacts. You get bigger rebates. It's better. I'm guaranteeing this. You're going to get 100% money back guarantee on this product in my office. Even if your prescription changes, I'm going to honor that. I'm going to reimburse you and refit your child. So don't worry about that prescription changes. But everybody's office is different. Everybody's policy is different. And it hasn't always been like that when other places I worked. But in my own practice where I can control those things, I try to do what's right or make it right.
Tell us about the new LASIK, because it's all over the airwaves. I think they said, was it like $110, 15 minutes LASIK surgery, and you don't need this, throw this in the trash. So give us an idea. I'm a doctor. Maybe I'm old school conservative. I still carry my glasses, but a lot of my colleagues are going to LASIK, LASIK. Give us a little idea what it's all about in that, since it's in your field. You can give us a little bit of a history.
Years ago, we started out with RK, where it was actually cutting the cornea, the tissue. When we went to PRK, then we went to LASIK, and now there's even newer procedures called the SMILE technique, okay? Both LASIK and SMILE are less invasive and little to no downtime. They have now improved it to where the prescription can actually be even carry more myopia or nearsightedness and astigmatism. So the parameters have greatly expanded, making it available to even more people to be able to go get it. However, it's been safe. It's safe. It's been proven safe. We've not had anybody in the United States that's gone blind from this procedure. I do refer people to go have it done. But there are people like you and me, myself. I've not had it done, but, for other reasons.
So it's 140, 150?
That's
or is it
Dr.
different
Tobe.
strokes? I see it on the journals. I just wonder what the real price is,
I send to a very consistent surgeon that if I had it done, I would pay the same price as someone else that I sent from my office. And
does
so
insurance pay for it?
Now, very little. Very little. There are certain vision plans that I think will give discounts.
But most don't really.
No. And in this area, I do think that there's still a premium. It's higher than maybe somewhere else. But I also tell everybody, you don't want to go somewhere that just advertises these specials. This is your eyes we're talking about. You need to check that out
Make
and
sure the
make
surgeon he's done quite a few before you are the first he does. But like you said, there's very few, Tell us, you are an independent optometrist. Now, you and I know there's lens crafters, there's the big chains, then so there's the brick and mortar chains, then there's the independents, then there's this what I call online. They're not
Yes.
optometrists, but they're online optical stores. So, what do you see the future of optometry? Are you seeing more people becoming part of the chains, more people independent, or more people just going online for resource? I mean, what do you think in the next 20 years is going to be the face of optometry in America?
You know, I think that's a very good question, Dr. Toby. I think
Hmm.
we've all been considering like what's going to happen here because there's online refractions now where you can get your glasses, exam
Exam check.
online
Hmm.
and then get your glasses made. Um, I know me personally, that would never, even if I was not an optometrist, what I'm saying for my children or for anyone else, I just think it is such a personal relationship. It's so much more than saying is this prescription, which is better, one or two. How does this feel? How do you see? Being able to evaluate that in the office before you ever leave. Making sure I show patients like what they come in with, what I'm going to change it to, explain things, how they're going to have to deal with those changes if it's been a long time. Going from a single vision prescription to now needing progressive glasses, that is a big
Mm.
step. And so those measurements are very, very critical. I just don't know where that's going to go.
Wow.
I feel like, yes, that's going to happen, and I think that it's going to make people think less, and say, oh, well, I don't need to go see the eye doctor. They just want to, charge me a lot of money and come in for that. But there is so much more. Like you need to be checked for glaucoma.
Right.
You need to have your eye pressure checked. You need to be evaluated for macular degeneration. You need to be evaluated for diabetes. In fact, my mother, when she got her first pair of glasses, that was when we found out she was diabetic.
Wow.
My mother found out she had diabetes through her
Through the
eye
eye
exam.
exam.
So I discourage these people thinking that they're going to get a complete eye exam
Hmm.
online. That's not going to happen.
Right.
Now, there's always going to be, for all the baby boomers, we have a lot of people getting into the need of glasses. In fact, more and more people are needing glasses than ever before because of screens. You got to
Hmm.
think about what's happening today. Our children are learning to read at 4 or
Yeah.
earlier. And so used to a child would get their first pair of glasses like in between first and third grade. And we were even told to kind of wait. If that was the first time you're seeing the child,
Hmm.
have them evaluated again because truly it could be because they're just spending most of their time up close and that puts a lot of strain on the system. So they can come in saying they can't see the board, but it's
Hmm.
because they've been over focusing and trying so hard at near that it's giving
Wow.
you misleading information. So
Hmm.
don't just go get your child's exam because they're first complaining of distance. It really should be done before that so you
Before
can get
that.
baseline information because they could get glasses and it's just because of the strain up
Hmm.
close. But what I'm saying is I just want people to
A
know like
personal
a
relationship.
personal relationship, and
Right.
and people will due to insurances now they hop from doctor to
Doctor
doctor
to
because their
doctor.
insurance is changing, and I understand that I in a way, but at the same time if you go to another doctor and that prescription has changed a lot,
Hmm.
that should be a
It's not gonna
sign
be
that
right.
should not happen.
Let's hold that thought. Dr. Floyd has been generous. She's shared her heart with us. The next session, we're going to talk about her home life, her faith life, her family life, her ministry, and her mission life. You don't want to miss it. This is Dr. Tobe Mummer and Dr. Floyd telling you Jesus is Lord. See you next week. God bless you.
Oh gosh,
You
we were
did
over. I'm
great.
sorry.